Welcome to Employment Law This Week. I'm George Whipple. Human capital often drives the value of M&A deals in the healthcare industry. Buyers involved in those deals must retain key employees in order to secure that value. This week, the hosts of two Epstein Becker Green podcasts join forces to talk about strategies to retain these employees. Many states don't allow corporate entities to employ licensed professionals, so many healthcare M&A transactions must be structured to keep employees at a professional entity like a physician's practice. This can create some complications around employment agreements.
That involves a lot of nuance, and one of the areas where we run into that nuance is, of course, restrictive covenants. The covenant has to sit with the employee at the practice, and it's the practice's covenant to enforce. The nuances on the professional services side abound and vary considerably depending on whether we're adding a new practice to an existing platform or have to set up that platform to start.
That's Epstein Becker Green's Tim Murphy, one of the co-hosts of the firm's Diagnosing Health Care podcast. He and his co-host, Dan Fahey, joined Kate Rigby and Erik Weibust from Epstein Becker Green's Spilling Secrets podcast for this month's special crossover episode. Dan discusses some more challenges when it comes to how restrictive covenants are structured for those deals, including striking the balance of patient choice.
You don't want to be seen as an employer that wants to aggressively enforce restrictive covenants, and especially in the healthcare space, because people want to have the ability to choose their provider and go to the provider of their choice. But if they're being sidelined by a restrictive covenant, it can be a deterrent from other physicians that you might be trying to recruit. So there's a host of issues that we evaluate when conducting these diligences.
When a human capital intensive deal lands on Erik's desk, he tells us the first thing he does is locate and gather restrictive covenants and other documents. Then he tries to learn as much as possible about the workforce. Erik essentially aims to get a census of key employees, including titles, roles, and locations, in order to account for different restrictive covenant laws around the country.
But at the end of the day, really what I want to know is who's important, who's a flight risk, who's a threat if they go to a competitor, and what kind of documents and agreements do they have in place to make sure that these folks will stay.
After gathering this information, employers can then begin the process of securing those key employees. Kate recommends a carrot and stick approach, with incentives like retention bonuses, employment or shareholder agreements, and stock options. On the other hand, to protect the employer,
that would be really looking at what we're talking about today, which is restrictive covenants. And so whether that is a non-compete, if they're in a location where you can create an enforceable non-compete, or non-solicitation of customers or employees, which of course can be really critical. And then, of course, finally, confidentiality agreements prohibiting and preventing the disclosure of confidential information, and also really keep trade secrets as well.
The Spilling Secrets and Diagnosing Health Care teams continue the discussion in this week's crossover episode, covering the Stark Law and how to build a wall around those key employees that headhunters can't jump. Subscribe to the Employment Law This Week feed wherever you get your podcasts to hear the full audio episode. Thank you very much for watching, and we'll see you next time.